This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Heinz-Josef Lenz, Associate Director for Clinical Research and co-leader of the Gastrointestinal Cancers Program at the USC Norris Comprehensive Cancer Center. Dr. Lenz is Professor of Medicine and Preventive Medicine, Section Head of GI Oncology in the Division of Medical Oncology, and co-director of the Colorectal Center at the Keck School of Medicine at the University of Southern California. Welcome back, Dr. Lenz.
I'm happy to be back.
Dr. Lenz, can you offer any explanation to the rising incidence of young adult colorectal cancer?
I don't. Absolutely unclear. But I tell you from our experience what happened. I went to India, and India is a country where colon cancer is one of the lowest in the world. And the incidence is very, very slowly growing, not in any dramatic way comparable to Japan or China, where it's out of control, more related to the lifestyle and the diet. In India, not. But what do they see? They see suddenly in the 20s rectal cancer arising, and no explanation possible. Now, in the county hospital in Los Angeles, where we see the Hispanic community, we see the same thing. We see young rectal, we see biphasic distribution between 20 and 30, and then the typical 50 to 60. We have no clue. We're actually starting a project to look if the mutational and the genetic predisposition patterns in ethnic diverse communities are completely different. But we don't know, because usually rectal cancer is not linked to diet, it's the colon. So there must be a genetic component. I think what we have neglected is focusing so much on the tumor mutation. The interaction of the tumor with the host, the patient itself, is very important. We know Asian patients are different than Caucasian patients. Their coagulation system, their angiogenic pathways, their DNA repair is completely different. They will have different levels of benefit of treatments.
What about BRCA positive patients and the increased risk factor for colon cancer?
Yeah, I always have it. When I'm teaching medical students or resident, one of the most impressive cases I've ever seen was the pediatric orthopedist, female, BRCA1, breast cancer, treated successfully, had years of GI symptoms. Everything was related to the chemotherapy, never done a colonoscopy, and she passed away with metastatic colon cancer. You always see and never forget this link. There is a connection, and they need to do colonoscopic screening. There is no doubt. And it's actually not so far off when you think about it, because BRCA and mismatch repair are both playing a role in DNA repair. If you cannot fix the damages in DNA by any system, you are at higher risk. Depending where this DNA repair system plays a role, it is in different organs.
Thank you, Dr. Lenz, Associate Director for Clinical Research and co-leader of the Gastrointestinal Cancers Program at the USC Norris Comprehensive Cancer Center, Professor of Medicine and Preventive Medicine, Section Head of GI Oncology in the Division of Medical Oncology, and co-director of the Colorectal Center of the Keck School of Medicine at the University of Southern California.
Thank you very much for having me.
Thank you for being back.